Sleeping pills now linked to increased risk of cancer, heart disease, and death. That's quite a headline. Hi, I'm Dr. James Machino, but I didn't make the headline up. I'm referring to the article that appeared in the British Medical Journal in February of 2012. The lead researcher was Daniel Kripke from the Scripps Sleep Center in San Diego. So this is an area that has been of interest to him for a long time. And the study included 10,531 patients who were taking sleeping pills on a regular basis. They were prescribed by their physician. And they took those pills for, on average 2.5 years as they were followed in the study. And the patients were compared to patients who were not taking sleeping pills, almost 24,000 patients who were the control subjects in the study. And these are the study results, that the sleeping medications were associated with an increased risk of cancer, heart attack, other ailments, and also increased risk of death. And so the types of sleeping medications we're talking about are the ones you know about, the benzodiazepines like Ativan and Valium and that sort of class of drugs. And also others commonly used sleeping pills that you're familiar with. You see the ads on television. Ask your doctor for this, ask your doctor for that. And in previous studies, Dr. Daniel Amen, in his book, Change Your Brain, Change Your Life, showed that some of these types of medications also do damage to the brain over time. Now, between the year 2006 and the year 2010, there's been a 23% increase in the prescription for these types of sleeping pills. And so in the United States alone, that represents $2 billion worth of sales annually of prescription sleeping medications. Now, I personally don't understand why these are the first line of treatment drugs or agents that are used for people that have insomnia or sleep disturbances. And I say that because with aging, the brain stops making optimal amounts of melatonin. It's just part of the aging process. And it's melatonin, that hormone that allows you to get a much deeper sleep. When you're 12 years old or 8 years old and you're sleeping, really well, it's because the brain is making melatonin. It induces sleep. It also attaches to receptors on immune cells, makes your immune system more effective. And it's been shown melatonin has really important effects on preventing breast and prostate cancer. And it acts as an antioxidant in the brain to protect the brain tissue against damage from free radicals. And free radicals in the brain are linked to all kinds of things, from Alzheimer's disease to Parkinson's, MS, other neurodegenerative conditions. Studies with melatonin supplementation have shown that it helps people get a nice normal sleep naturally. And it also acts as a brain antioxidant, protecting the brain against damaging free radicals. Dr. Lissoni in Italy has shown us that if you use melatonin as part of treatment for prostate cancer, now even breast cancer, that should be part of the adjunctive nutritional management because it's important even on the treatment side of these diseases. And we see that melatonin has an effect on increasing immune system function, which is important throughout your entire life. So the side effects of using melatonin to get a better night's sleep are all really positive. There's no increased risk of cancer and heart disease and premature death and other ailments. Melatonin should be the first choice. But I like melatonin in a supplement with other nutrients like 5-hydroxytryptophan, 5-HTP, which the brain can convert into serotonin or more melatonin if you need it. And also with GABA, which is gamma-aminobutyric acid. The brain makes some GABA, which stimulates its GABA receptors. That induces some decreased anxiety feeling so you can get to sleep more easily and stop your brain from being all wound up. And so benzodiazepines do that, but they do it in a more artificial way, and that becomes the problem. And then I also like Bacopa monnieri. You're saying, what is that? That's an herb that's used in India that's been shown to improve sort of memory consolidation, so you have improved memory as you age, and it stops free radical damage to the brain. So I personally like a supplement that contains melatonin with 5-HTP, with GABA, and Bacopa monnieri. And I really believe that doctors should recommend that type of supplement first for people that have sleep disturbances. That should be the first line of therapy because it's safe, it's natural, it's effective, and it works with the brain's natural physiology. Now, what I suggested is you click on the link below and you can see my review article on this subject entitled Combating Insomnia Naturally. I think if you have any sleep disturbance problems or you've been using sleeping pills in the past, this is an article you really should read. Now remember, at machinohealth.com you'll see my other research articles and review papers, resources, downloads, footage from my live professional seminars. All these resources, they're all there to help you lead a long, healthy, functional life. All my research articles and my teaching materials are complete with all the scientific references, so you'll know you're getting only sound scientific information from me on any topic that you're looking for. So make sure that you use machinohealth.com as an ongoing, reliable resource for health and wellness information for both you and your family members. Thanks so much for watching.